This is How to Healthcare. I'm your host, Emily Persley. My guest today is a community health educator who has been in the Athens area for over 20 years, working to build a healthier community. I'm so excited for you to learn more about Katie Calkin and what she has going on. You'll want to stay tuned until the end. She has a hilarious, embarrassing story. And don't forget to click on the subscribe or follow button to get the latest notifications. Welcome, Katie. Thank you so much for being on the podcast today.
Hey, Emily, thank you for having me. It's a treat to talk to you always.
I'm so glad that you have the time to take to talk to us today about what you do at Piedmont Healthcare and your role as a health educator and your involvement in the community. So I really appreciate your time with all that today.
It's a pleasure.
Well, let's just jump right in and let's get to know you a little bit about your personal background, you, your family. Let's talk about that a little bit.
Okay. I live in Athens, married to an artist, and I have a daughter in 10th grade at Cedar Shoals, and I have a daughter who is a freshman at Davidson College in North Carolina. So that's been a big adjustment for our family this year.
Yes. Yeah, that is always such an
Yeah.
adjustment when life starts changing. Yeah, your husband's not just an artist. I mean, he's fantastic. Anybody can catch his work around in the Athens area.
Thanks for saying that.
It's such a joy to see his artwork out there. And it took me a while. So Katie and I used to work together over at Mercy Health Center, and I did not even dawn on me that was your husband
Oh, yeah.
for a while. Yeah.
Yeah. Yeah, people tend to look at the colors and because his work is really joyful rather than the name. So
Yeah.
makes sense.
Yeah, but yeah, his work is fantastic. And it's so great that your girls are just moving along and high
Yes.
school and college and all the adjustments. That's great.
Everybody's growing up.
Yes. Well, I want to start in on some about you and a little bit about your health and wellness journey, because it's always interesting to see the impact people's childhood have on their adult health and wellness. So
Right.
let's talk a little bit about that.
Yeah. So I grew up in a family where health was really valued, and my mom cooked dinner every night, which I do not know how she did that, but every night, a hot meal, lots of fruits and vegetables, meatless meals before that was a thing. Both my parents exercised, and my brother and I were, constantly told to play outside. So we were always moving. And I played sports in high school and college until I was injured. I ran with my dad on the side, and he did have a no pain, no gain mindset. So that is one thing about my upbringing around health that I've had to adjust because that mindset can get you into trouble.
Yeah.
I still, just like to cook myself, and I like taking that time to prepare food. It takes longer to chop fruits and vegetables, but it feels like a good thing to do for my family. And I really like to exercise. I'm actually struggling with sciatic pain right now. So I've had to really limit my exercise for the last few months, and that's just reminded me to have compassion for everybody who I work with because it is a struggle to be in a human body. So
Right.
having to make adjustments right now. But so I grew up where health was, a priority for my family. And then I really thought I wanted to be a doctor in college. And as many people do, right?
Right.
Right. So then, after college, I was just finally had a pause, like finally looked up from studying, and I was only working and not, juggling a million things. And I started thinking about what it really looked like to be a doctor and decided I was actually not interested in taking care of people who were sick, that I really was more interested in helping people maintain wellness. So I kind of withdrew my place in med school and worked for a couple years and was pretty lost actually because I'd been so focused on a goal for so long.
Right.
And then public health kind of came on my radar from a friend, and it just you get those intuitive feelings where that's it. Like
Right.
that's
Yeah.
that's what I want to do. That's what I want to do. So
Yeah.
that's how I kind of came to being a health educator.
Oh, yeah, that's the same. I wanted to be a nurse. And then when I found out about public health, I was like, oh, yeah, yeah, I
Right,
love that.
right.
Yeah. Just
Yes,
getting to help
yes,
people like prevent things and just trying to get on the front end more than trying to
exactly,
heal. Yeah.
exactly. Yes,
Yeah. It's like you
same.
just found your place and it's like, yep, here we are.
Here we
Woo!
are. This is it.
Part of the
Yeah,
team. Yes.
right.
That's
It's a good
awesome.
feeling.
Yeah, it's amazing to see. And it is so important as moms that we realize now the impact that health had on us as children and the impact
Right,
that we're having on our families,
right.
moms and dads and everyone. I mean, just the impact that we have, because it really is lifelong learned behaviors. And
Absolutely.
yeah, that's awesome. So let's jump into a little bit about your work and education background. Like you're at Piedmont Healthcare, and how long have you been
Yes.
there?
I've been here since 1999. So I'm coming up on, I think in a couple weeks will be 23 years. So
Wow,
a
that's
good
awesome.
while.
Yeah.
Yeah, which is pretty wild because I jumped around for a good bit before this.
Yeah.
So,
Yeah. And so
yeah.
not only are you at Piedmont, but you also do volunteer, or part of your work at Piedmont is your community outreach that you do. So
Yeah.
some of the organizations you do with that.
Yeah, so I'm a community health educator. So part of my job is to offer things to just anyone, community at large. And then we target places like business and industries, hitting people at their employers. And we have Safe Kids programs where we're targeting families. But then some of my job is with community benefits. So we do every 3 years a needs assessment of the population, see what are the big things people are struggling with, and where are people who are more vulnerable, people who are underinsured, uninsured, lower income, having trouble connecting to healthcare resources. What are their needs? And
Mm,
then we go to organizations like Mercy Health Center, where you and I first connected, and try to offer things that meet those needs.
yeah.
My favorite part of my job is to work with people who can't just Google what they need and then go out and buy it. So people who are
Right.
really like struggling to figure out how to take care of their health, to work with those folks. That's where my heart really is for this job.
Yeah, yeah, and that's a great resource that Piedmont gives for you to be able to go out and reach all in the community to improve that access, because that's a lot of what has come to the forefront here lately, and it's really hitting the news right now about just access to care. And it's just
Yes.
it's I mean, it's been on the radar for public health for a while, but
Right,
when things
right.
get when
Right. But
things
it's
get
nice
rough,
to
it
see that getting
yes,
the attention that it's due. So
right.
that's good.
Yeah, yeah. Um, so part of you talked a little bit about your education that you decided to go for public health, but you have a
Yes.
master's level in public health,
Yes.
but you also have some other letters at the end of your name that
Oh,
maybe everyone doesn't understand with the
sure.
MCHES. So talk
Sure.
about that a little bit.
Yeah, so I have a master's in public health, so that's the MPH, and then the MCHES is a master certified health education specialist. So there's an agency that credentials health educators, because that word, like other professions, there can be titles that get used in different ways, and can mean different things at different organizations. So that certification shows that you are trained in a specific set of skills, like assessing needs for individuals and populations, developing materials, creating communication strategies, evaluating programs. So it shows that you have a specific skill set.
Yes, yeah. Yeah, and you have to actually be go through testing and certification and meet
Yes.
certain standards for that. So
Yes.
it's
Yes.
thorough training done with that.
Yeah. So it's helpful for an organization that wants someone who has those skills that can be applied to lots of different topics and populations, but it helps them know who they're getting.
Yeah. And which is really helpful now, like what you were saying is in this sphere of health and wellness. That's why I love having these conversations. All the different wording and things just gets really confusing.
Yes.
So it's good to be able to define exactly what You are. So based
Right.
on that, like, let's talk about that. Like, what is a health educator? Because I just want to clearly define that, and talk about what you are and what you're not.
Yeah, and I think that's where part of the confusion comes from because health educators are generalists and have a wide skill set. So you could be a health educator in a clinic setting working on one specific health topic, like maybe HIV. Or you could be a health educator managing one specific grant and really managing the funds and the personnel for that. Or you could be someone like me that is working out in the community where every day looks different. So I think, we create some of our own confusion in health education by being so
Right.
broad and general. Um, so I lost myself in answering your question.
No, you're good. Yeah, because, well, so some of the things that like a health educator isn't, because sometimes
Right.
people will get it misunderstood, like, oh, are
Yes.
you going to set me a diet plan, or
Yes.
are you
Yes.
an exercise fitness person? I feel like it just gets
Really
really confused in there
It
because,
can
like you
be
said, it is very
confusing.
broad. Yeah.
Yes, yes, it can be confusing. So we're not clinicians, and that's an important thing to be really clear
Yes.
about. So we're not diagnosing illness or developing, medical treatment plans. We're not registered dietitians. We may talk about general nutrition, and that's absolutely an important aspect of health education, but we're not registered dietitians. So if someone has a specific disease, we're not coming up with nutrition management, medical management from a nutrition standpoint. We may be exercise instructors, so I have another, set of training on being a group fitness instructor, being a personal trainer, being a Tai Chi teacher, but those are additions to health education. So we're not advice givers. I think that's a misunderstood thing too, where people think we're just going to kind of give some prescriptive advice and tell them what to do. So we're really trained to, ask questions and figure out what a person or a group of people are wanting for their health. My most utilized training that I have is in motivational interviewing. So, really listening, what do you want to be different about your life? And then helping draw out from that person how they can make that happen that fits into their own life because everyone's different. So, we can't just say you need to do XYZ. Well, what would that look like for you? And really helping draw that internal motivation and that plan out for themselves.
Yeah, and that's so important because a lot of people will think, "Oh, health educator, I don't need a health educator. I can just Google that." But
Right.
it's more than that. It's working through the specific person's health needs, the barriers, the different components. There's so many, areas in life that you just have to really work with someone. And motivational interviewing
Exactly.
is definitely helpful with that.
Exactly. Yeah, so it's really a lot of it when we're working with individuals or small groups is really coaching relationships. And then that word can get confusing too
Yeah.
because people think, well, a coach is going to tell me what to do and yell at me. And,
Right, right. Like back in high school days, a coach.
right,
Yeah, yeah.
right. But it's really a supportive relationship. It's really a partnership and a providing support and being a resource. Like if you need information, absolutely, we can provide lots of information, but it's not telling you what you need to do or how you need to do it, which I love because then somebody owns their own health changes
Yes.
and then they're going to keep doing it because it's what they wanted and they created it and they are finding joy in that and feeling the benefits of it and then they can keep doing that for themselves.
Yeah, that's so beneficial. And being able to create something for yourself because it's something you worked for and you just put more value into it for
Yes.
sure.
Yeah.
What's other beneficial or valuable for patients that see a health educator? Like, what can someone expect to get from a health educator?
Yeah, so I think a main benefit is the amount of time that we can spend with people. So, by necessity, clinicians have to keep moving from patient to patient, and they have to be directive in their communication, which is important. It's important for people to hear from their doctor, their PA, their nurse practitioner, you need to quit smoking, you need to lose weight. Like those, it's important to get those bullet points of what would improve their health. But the clinician can't spend the time with them. So, where a health educator comes in is we can spend a lot longer listening to the bigger life story and helping them figure out what that looks like, how that unfolds in their life. And, health educators bring some important qualities that clinicians bring as well, but like compassion, we know it's really hard to change your health. It's hard to change your patterns, your habits. It takes real intention, energy, and focus. So we bring that compassionate support. We really look for ways that people have been resilient. People carry so many different things in their life, and instead of being like judgmental about that, health educators bring kind of a discernment. Well, here's what I see as your strengths. Here's how I've seen you cope with really hard things. Here's how I see you being a resilient person. Let's apply those tools to this new situation that you're dealing with. So we kind of build on the skills they already have and kind of tweak and add new tools to that. So we have the time to build that kind of supportive relationship with people that clinicians just can't.
Right. Yeah. And that's so important. That's a huge piece is just the time because yes, clinicians are there to heal and we don't have the way our healthcare is set up. They just don't have the time. So it's really important to be able to really peel back the onion, find all the,
Right,
find all the things.
exactly.
Yeah.
Exactly. That's a
So
good way to put it.
yeah, speaking of that though, like, so if I'm a patient and I'm seeing a doctor and I'm like, okay, they just told me I need to lose weight or I need to stop smoking or I need to do this, like, where can someone go find like a health educator, have a one-on-one? Do you have to go find a community event? Do you have to go to the hospital? Like, how can we start
Right.
connecting more people with health
Mm-hmm.
educators?
Yeah. So I do want to talk about that community event piece.
Yes.
But for an individual just looking for something, we have a good kind of broad bullet points of our offerings on Piedmont's website. But if someone searches wellness programs at Piedmont Athens Regional, they'll get kind of a list of what our department does, or someone can just call 706 and that's kind of a good number for a general inquiry, and maybe I can meet their needs directly, or I can connect them to someone who would. Let's say they need a registered dietitian, then I could connect them to the outpatient dietitian.
Yeah. Yeah, that's probably a good starting point for some that are just like looking for some more education, but I think a lot of helpful things are even just in the group classes. So let's jump to some of those community events
Yeah.
that are offered because usually those are for free, correct? Or can we talk about if
Yes.
insurance covers or if they're for free or
Yeah,
what
yeah,
we're looking
usually
at?
they're for free, and that's often where I meet people who I work with individually. I often meet them out at community events. And so, someone that same web search, the wellness programs at Piedmont Athens Regional, that would bring them to things we can take out to groups, including a speakers bureau list that's got just a long list of health topics that we can come talk about. And then sometimes people will say, well, I want to work individually on XYZ. And then we form a coaching relationship. But yes, we do lots out in the community for free. Some are on purpose, like going a place like Mercy Health Center and offering a nicotine cessation class or an exercise class or blood pressure management class. I go to Daily Bread every week and do blood pressure checks and referral to healthcare. I do CPR classes at a church, might be doing a Tai Chi class at a senior center, stress management talk at a Rotary Club, maybe a mindfulness meditation class for a civic group. We do blood pressure, cholesterol, blood sugar screens at businesses. We do safe kids events like car seat checks, where we make sure people have the right seat and kind of install it correctly, make sure they can secure their child. So a whole variety of offerings in all kinds of places. So we're happy to come out to any group that would like that kind of service. And then from there, also happy to form coaching relationships with individuals who want to work on specific things.
Oh, wow. Yeah. So like an organization, if they're hearing this and they're like, yeah, that would be a great like event to hold or something, they can just reach out to
Yes,
you and get something
yes,
scheduled. Or
absolutely.
if you're an individual, they can go to the website and find
Hmm.
maybe a class being offered.
Yes, yes. Or if someone's interested in that coaching, they can call that 475-1029 number, and I'm happy to set up individual appointments through phone or Zoom or in person.
Awesome. Do you have anything in particular upcoming events that you want to talk about or highlight?
Well, if someone is thinking about quitting any form of nicotine, including vaping,
Yeah.
have a Courage to Quit class that starts next week, and that's over Zoom because I've been getting people from the whole Piedmont system, so people from the Atlanta area coming to that, and they could find that on piedmont.org/classes, and it would be Courage to Quit dash virtual is for. So that has been a big part of my job lately. A lot of people went back to using nicotine to cope with stress during the
Yeah.
pandemic. So that's been a very popular offering lately. And then doing it through Zoom has made it really easy for people to just jump on that wherever they are. Some people are doing it while they're driving home from work in the car. So
Yeah.
I would recommend that. Um, for sure, for people who may have slid back into using nicotine or for the first time be ready to make that change in their life.
Yeah. And just as a kind of a reminder about that, like when you have walked through this, I got to sit in on some of your classes at Mercy. It was so great because it was such a community of people where like just some little tips and tricks were discussed and like ways to do it because someone going in might be like, yeah, I know I need to quit, I don't need you to tell me I need to quit, but that's not what that's about.
Right,
Like what
right,
you do is so beneficial and it's a process. It's not like, okay, you're going to walk away from here and like be done.
right, exactly.
It's such a process because it was something like you said, a lot to cope with
Yes,
stress, and so it's a lot of that trying to find other coping mechanisms with
yes,
that.
that exactly. So that's so well. I mean, that's a huge part. It's life work.
It
So it's
is.
really getting in and doing that deep life work, and that is a process. And it's a lot for many people. It's easier to do that with a supportive group going through it
Yeah.
with you.
Yeah, absolutely. And so part of that, you've had some past involvement. I mean, because you've been in the community for so long, you've had some past involvement with if you want to talk a little bit about this, like the Athens smoking ban and some of the Athens Tobacco Prevention Coalition,
Yeah,
you could talk a little bit about that and some of your past involvement and where, like, how far, I mean, this is great how far so far we've come, like some things that have
right.
changed. Let's talk about
Yes.
that.
Yeah, that was super controversial at the time,
Yes.
and it's
Yeah.
just such a given now. I didn't mention that before that, public health educators also might be involved in research projects or in, like you just brought up, advocacy and policy work, and that's so
Right.
important. I tend to be a practitioner, kind of a boots to the ground, but that Athens Tobacco Prevention Coalition, that was a really great time that I got to be involved in policy work. And that was special because it really changes the amount of secondhand smoke people are experiencing. And it was a lot. It was a representation, representatives from many different health organizations, but we also worked with people in downtown businesses, who are they were understandably concerned that their profits might be affected. We worked with commissioners. So that was a really different type of health education work for me to kind of navigate all those different stakeholder relationships and trying to put out messages to the community to let them know what we were doing and what we weren't trying to do. Because sometimes that was misunderstood, and going to those county commission meetings, and that I was really just it was an honor to be part of that group. And now that kind of not smoking in public indoor spaces is a given. And
Yeah.
so it's amazing how our social norms
Have
can
changed.
change.
Yeah.
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 Yeah. But
That was,
I
I mean, it's
I
just,
remember sweating at the commission meetings. Like it was intense.
I can only imagine just because I remember public perception during that time. I was a college student at the university, and I just remember being at the bus stop and just like standing there in a cloud of smoke when it got cold because I think everybody thought
Right.
smoking a cigarette would keep them warm. I
Right.
don't know.
Right.
So
Right.
I knew once wintertime came, I'd be standing there in a cloud of smoke waiting for the bus.
Yes.
But then after that policy change happened, now the university campus has also adapted that
Right.
policy of
Right.
not even smoking on campus. It was huge. I remember like the restaurants, the bars, everything
Yes.
indoor. It was I remember a lot of pushback.
Right. Right.
It was a battle worth fighting, and we so appreciate your part in that because I think it has made a difference. And now nobody really thinks about it, but that's
Right.
why I wanted to highlight the hard work that went into that.
Yeah.
But that we can be a healthier community just by
Yes.
taking those steps. Yeah.
Yes. And I think sometimes, public health work, sometimes people think, oh, that's the government. It's people trying to take away my rights or tell me what to do. But it helps to look at examples like that where people who are really happy to have clean air in a restaurant. And then, clean water, that's public health. Your trash being picked
Yeah.
up, that's public health. That you buy a car and it automatically has a seatbelt and a shatterproof window. You don't have to think about those safety features. So there's lots of public health that's just designed to make everybody healthy without them having to put energy into it and think about it, that you're setting up this environment where people can be healthier.
Yeah. Yeah, and it's really important part of public health, like you said. You just sometimes you don't see all the behind the scenes
Right, right.
work that goes into it, and a lot of
Yes.
research. And so some of that research too, you've even put into childhood obesity and working in the community about that. You want to talk a little bit about some of that work you've done?
Sure. Yeah. So we have a program called Health Matters for Families. That's a coaching program for families who have kids who have some extra weight, who are kind of trending upward with that weight. And the pediatricians identify them as needing to work on their health habits so that that trend can change before they become an adult. So we work with the whole family, and that's a lot of motivational interviewing because every family has different dynamics. So
Yeah.
health looks different for everybody. And we work on setting goals and then tracking those goals for nutrition and exercise, sleep, screen time, all the things that affect our health that can be a challenge. And when we're so busy, we may not be thinking about it, or the consequences they have on our bodies. So we really help the families take a look at what good health looks like for their family. And again, I'm a practitioner, not a researcher, but we did do a partnership with some researchers at UGA who used our families for some needs assessment for what do people need around having a healthy weight and healthy habits in general for families. And so that was a really helpful partnership to let the university be able to see what real families are struggling with.
Yeah. And that's so important. If you've ever been asked for like a survey or research, those needs assessments are so important for our community and for individual health because it's not helpful to just go in assuming that someone's not eating good because they're lazy. That's incorrect.
Exactly.
It's so important to do a needs assessment to really find out what the barriers are and what are some of the
Right.
things that are hindering good health choices, because
Right.
some of it is very difficult
Yes.
given our circumstances to be able
Yes.
to. So that's really good. Going back to focusing on the family again, just the influence that parents or guardians can have on kids at a young age, and maybe they weren't taught so they can't teach. It's really important
Yes.
generational to
Yes.
be able to
It
do that.
usually it's rarely like my child has this health problem. It's our whole family dynamic is built around unhealthy habits, and that's what they've inherited from their family. And so, yeah, it really has to be the whole family culture changing. And then, like you said, that will be a ripple benefit for the kids that we're working with now, for their kids and their grandkids. So that feels really good to work with family dynamics like that.
Yeah. That's really good and so important and such a key to being able to change, because that's been another discussion all the time, is that how much public health has changed because of all the things that we're learning, all the needs assessments that are being
Right,
done, all the
right.
research that's being done to be able to help the public improve our health, because it's just so important as we get older, just to be able to support and come at it the best health as we can as we age.
Yes.
Because, like you said, you don't know when you'll get that sciatic pain, or I
I
get,
know,
foot
right?
problems. It's
The
like you
body
gotta,
will humble you at some
yes,
point.
you gotta come at it being healthy as you can, because
Exactly.
we'll get those barriers sometimes. And
Yes, it's inevitable.
right. Yes. Yes, exactly. So let's talk about a little bit more about where we are as a community with COVID coming through. So much changed, I'm sure, about your job. So, what do you think is kind of going on in our community, our views about obesity after COVID? Because a lot of what we found out was how much effect and how many what they call like chronic illnesses, things such as
Yes,
diabetes and high blood pressure, had effect on our survival rate with
right,
COVID.
right. Yeah, I think it did really open people's eyes to that our health, like you just said, like what you come into a health problem with, and that could be something like COVID. The state of your body when you get into an injury or an illness really affects your ability to recover and maybe even live. And so COVID really did highlight that. There are some people who in the past would say things to me like, it doesn't matter whether I exercise or eat well because I have to be on blood pressure medicine anyway. But then they
Yeah.
realize, oh, it really does matter if my body is functioning well, if I'm enjoying, a robust health, then I can withstand injury and illness so much better and have a better quality of life. Even if you do need to take medicines, that's also inevitable for almost everybody. But the
Yeah.
quality, but your quality of life can be better with your health habits. What we do day after day after day makes up a big part of our health and wellness experience. So I do think COVID opened that up for a lot of people.
Yeah. Also, going back to the smoking, you were talking a little bit about the vaping. I feel like we went from cigarette smoking to the vaping,
Yes, so
and
true.
we could highlight just a little bit about with the vaping, like the I guess a little education on the vaping of the good, the bad, the what's going on with that.
Sure. Yeah. I mean, unfortunately, at first, it seemed like maybe vaping could be a good alternative to smoking. And then we're finding out that vaping also hurts lungs and can cause really catastrophic conditions for some people. And the vaping companies have to um, publish the ingredients like as is on the shelf in the products, but they don't have to say what happens when those products are heated and vaporized. And so we're finding that there's lots of chemicals that hurt people's lungs when they do that. So it's not a safe alternative, which is really unfortunate because that would have been great. if
Yeah.
it was. Um, Vaping can be useful sometimes for people just to switch the mechanism that they're getting their nicotine through, and then kind of practice some of their new habits and coping skills, and then cut down on the vaping. But you have to be super intentional about that if you're using vaping as a quitting tool. You have to have a real clear plan for yourself about how often you're going to vape and what that looks like, and whether you're tapering down the amount of nicotine that you're getting through that vaping. But in general, just like smoking, vaping is a good thing to avoid for your health, unfortunately.
Yeah. Do you think there's anything else, like either your top choice or your top two, that you think as a community that we really need to start addressing, or maybe that you're already starting to address?
I think that there's a lot of grief left over from
Oh,
the
yeah.
and is of people and relationships and jobs and you know years of school for kids, just a lot of changes, and now it feels like we're trying to slam ourselves back into life as usual. And there's a lot of emotional wounds. That tends to be what is coming out when I'm working with people individually, is that they're just carrying a lot of grief and wounds from the pandemic. And so addressing those things is really foundational for moving forward with good health. And that can be, through counseling or skills like mindfulness. I think grief has been like just over and over. That's what I'm hearing people talk about.
Wow. Yeah. That's so important because you're right. It would not only just like a loss of loved one, but like loss of time, loss of events, loss of things where we
Yes.
expected our life to be. And
Right.
we just have to be like okay with it now. And
Yeah.
maybe some aren't processing it. So that's, yeah,
Yeah.
that's great.
Some people have
Um,
really different jobs. Some people have kids who are not ready for the next grade. There's just so many ripple things that have happened.
yeah. Yeah, and one of the part of that with grief, as I've noticed even, is that we're really starting to pay more attention to mental health, and I love
Mhm.
that that is coming to the forefront and being
Yes.
talked about more to
Yes.
undo some of the stigma and talk more about. I
Right.
mean, we even had the recent change in the suicide prevention line. I
Yes.
think it's great that we're addressing that as well.
Yes, it is a human condition to struggle with mental health. It is not sign of weakness or a lack of willpower or that you're made wrong. I mean, is a huge component of health that we all need to tend to, and that can look differently at different times in our life depending on what's going on. So it's really great to take away that stigma.
Yeah, yeah, absolutely. Um, well, can you think of something else, that maybe I haven't asked you about yet that you wanted to talk about, some of your
Hmm.
involvement or anything else going on at Piedmont or in the community?
Well, um, you're gonna have to edit out my long pause, Emily. Or leave it in so people know this is real, right?
It's real.
It's real. You'd asked me about a nonprofit shout out.
Oh, yeah, yeah,
So
we
I
can talk
do,
about that.
yeah, I'd love to put a shout out to Our Daily Bread, which is part of Downtown Ministries now. And I do go there for work. So I hear a lot of people's stories and all the things that people are struggling with and all the things that people really are overcoming. It just every week I'm like, wow, human beings are resilient. And then I cook there with my church once a month, and that's a real joy to get to make a meal. And they could use more people for making breakfast and lunches if there's a group of people, and it doesn't have to be huge. It can just be 4 or 5 people who come together and create the meal, and then get to serve it to folks and maybe eat with people, and just kind of get to know what is happening, because sometimes we can get in our own little bubble of commuting from place to place, and just doing our jobs and getting our errands done, and that is real. There's so much to every day for everybody and every family. Um, but if somebody was interested and just hearing about people who are maybe having different life experiences, that's a great place to have some relationships,
So
and
talk a
provide a
little bit.
meal.
Oh, yeah. So talk
Yeah.
a little bit about so is that what that organization does, is just provide meals, and what's the
Yes,
population
it
they
is
serve?
based around coming to the table together to eat, and then a lot of people get social service connections through that too. Talk about what they need, and then they figure out what agencies can help meet those needs. But the main idea is people coming together, eating together, people who have more resources getting to share by buying food and breaking bread with people who are don't have as much resources flowing in their lives, and so it can be for anyone can eat there anytime. So some people are truly living on the street or in their car. Some people are kind of bouncing around couch surfing from place to place, and some people have jobs and secure places to live, but their income is so small that eating at Daily Bread, some or all of their meals, helps them stretch their budget so they can buy other things like medicine. But
Yeah.
anyone is invited to the table, and sometimes community leaders come just to talk with people and check in and hear what's kind of happening.
Wow. That's fantastic. I love that you shared about that, because I feel like sometimes we don't know what we don't know. And it's like just trying to find out what's out there for resources,
Right.
or like if you need the resource or if you want to help.
Yeah.
There's lots of ways to get out in the community
Yeah.
and do that.
Yeah, yeah. That's a place where a lot of good connections are made and a lot of unexpected relationships form between people, which is really cool to see. Because,
Oh,
at
yeah.
the end of the day, everybody has more in common than not. But sometimes
Right.
we can forget that.
Yes, right. We're all human, all trying to make it. And what
Yeah,
one person might seem like they've got it easy, there's always something.
right, right, right.
Yeah. Yeah.
Yes,
Always
yes,
something. Well,
yes.
um, I want to ask you about, what is your favorite app that maybe you could share with us if we would want
Yeah.
to tune into it?
Sure. So my favorite apps recently have been things that support mindfulness practices, and that coming out of the pandemic, a lot of people have said that that is a tool that has helped them when they're feeling like really overwhelmed, and that can turn into kind of acting in a frenzy, kind of just spinning around constantly, or it can act in people getting frozen. So the mindfulness tools can really help you kind of just take one slice of life at a time, and be present with that, which can increase, your feelings of having everything that you need, that you can cope, that you do have the skills that you need, and can help kind of bring a little bit more ease and flow to life. So I really like Headspace is my favorite. Meditation app. There's tons of them out there. So I encourage people to kind of search for what would work for them. Another one that I really like is Plum Village, and they have some really nice short meditations that can be good. So just to take a few minutes, to take a few deep breaths and kind of arrive in your body, and then move forward with a little bit more intention and just
Hmm.
a little bit more aware, which is interesting because a lot of people say that they are overwhelmed and they can't cope and they can't deal with things. But when they relax for a few minutes and kind of get
Mm.
regroup, they're like, actually, I can do that. I can take
Right.
that next step.
Yeah. Yeah, that sounds like a great app, because you're absolutely right. It's just taking a moment, getting centered. And I've talked before about just bringing balance. And that's not like where everything's like great. It's just getting centered and having feeling like you're in control, and like
Yeah.
where you've got it, like I
Yes,
got this.
exactly. Exactly. Yeah,
Yeah, that's really good. Yeah, thanks for sharing about that too.
sure.
So I do like to end on some fun stories. Can you tell me a funny or embarrassing story about you or your family
Well,
that you want to
my
share about?
family recently had a big public embarrassment that we are laughing rather than crying about.
Keeps us humble, right?
Right, right, right. So, my husband Jamie, who will paint anything that doesn't move or we laugh. He will paint what moves too, because he's painted a number of art cars. He's driving one van now, but there's another van out there that's all around Athens that someone else is driving. But so we were moving our daughter to Davidson in August, so he like whited out part of his van and painted this huge Davidson scene and the
Oh,
mascot and
wow.
everything. And like he even researched the move-in line, like which side will that be seen
Oh
on,
my
you
goodness.
know? So we get there and and I was proud of my daughter because of course driving in an art car was embarrassing for a period of
Hmm.
time, but she's embraced it and she was really rolling with it and people were just coming up and stopping and we were in this long line of people kind of inching up to the dorm area and we were kind of a rolling photo booth. People were coming by and taking pictures and snapping and passing it on and we were, my husband was feeling, pretty great about himself, pretty proud. And then our engine started to overheat and we ended up blowing the whole radiator, creating this whole scene. And we had to cars had to move and we had all these college students pushing our van. And so we ended up, just abandoned on the side of the road. So it went from glory to, you know, folklore. People have come up to Violet and said, "Were you the one whose van blew up in the
Oh,
moving line?" So, it was
y'all.
such a good reminder that you can be feeling on top of the world and then life just brings you back.
Oh my
Right?
goodness. I'm sitting here thinking, oh
Right.
man, she's got to live with
Right.
such a cool dad. But man, y'all
Uh,
really made an
yeah.
entrance. Yeah.
We made an entrance. We sure did. We sure did. So if you have a move-in situation when your oldest goes to college, check your radiator fluid before you head out. That's all I'm saying.
That is such an awesome story.
Right? Pro tip right there.
That is so cool.
Oh,
Thank you so much for sharing that story. That is
uh,
awesome. I always
it's
love a good
ridiculous.
laugh.
Life is ridiculous.
That is
Oh.
so cool. Oh man, thank you so much. That's awesome. So let's go back. Let's talk about how someone can contact you with questions, appointments, where they can find you, all that good stuff.
Yeah. Yeah, so they can reach me directly, 706-475-1029. Or if they're interested in just getting an idea of all the different things our department does and maybe having someone come out to a group, they can certainly call that number or look at wellness programs at Piedmont Athens Regional and they'll get kind of a whole menu of opportunities there.
That's awesome. And they can find you on YouTube.
They can. That came out of the pandemic. Some groups I was working with, were like, "You can't come, but can you send us a video?" It's like, "Oh God, can I?" So I learned how to use the camera on my computer and how to load things up to YouTube. And so yes, and we're still sending some videos out to some places that just are requesting specific things to show their groups.
Yes. Yeah. Well,
Yeah,
I had
not
fun.
something I saw in my life.
Well, I thought that you were such a good sport, and we had so much fun recording for Mercy Health Center some fitness
Oh, we
videos. They were
did. I
fantastic.
forgot about that.
Yes, the
Yes.
smoking, fitness, it was all great. I mean, it was
See,
just
you warmed
another
me up for that.
just another avenue, just trying to get the word
Right.
out.
Right.
That is
Yes.
so cool. Well, I so enjoy talking to you today. You're just an expert in
Oh,
this field, and you've done so much for the Athens Oconee and all the several counties in the area around us. You've just had such an
well,
impact already, and we are just very fortunate to have you.
Right
leading the
back at
charge.
you. Right back at you.
And I just miss seeing you all the time at Mercy.
Same. Same. I really do miss you. Yeah.
Well, I hope to see you out and about in the community at some point. I know we will
Yeah.
cross paths again, and I just so
Absolutely.
appreciate your time talking to us
Oh,
today.
I appreciate you, Emily.
Thank you so
Take good
much.
care.
Thanks, you too. Bye.
Bye.
Thanks for listening. I had a great time talking with Katie. If you enjoyed it too, tell a friend about the podcast and rate the show. Come follow me on Instagram or Facebook as we prevent, maintain, and navigate our health in the healthcare system.